Some patients think they caused their cancer. If you smoke cigarettes and you get lung cancer, there is a chance that if you hadn't smoked cigarettes, you might not have gotten lung cancer. But in general, no one causes their pancreatic cancer or their breast cancer. And there are patients who think they did. And our job is to change that thinking, to help them move forward. Some patients can feel guilty that they didn't make the right decision, let's say, years ago when they were offered treatment for early stage breast cancer. And they may have declined all treatment, or they may have declined some of the treatment, and now they have a recurrence, which is stage 4. And it's very difficult for them to stop looking back and saying, I should have, would have, could have. And we spend a lot of time telling patients, first of all, it may not have made any difference whatsoever had you done what we told you to do. And it's very true. We constantly will say, don't look back, let's look forward. It's just draining to look back. And I think with time, patients probably stop doing that. Stop blaming themselves. Certainly patients who didn't get their screening mammograms and they end up with an advanced case often kick themselves. You can't erase that feeling. You can't take a feeling away from a patient, but you can take a behavior away from a patient, and you can help them to make good decisions now, not be paralyzed with fear or shame or guilt. Social workers are here, and if necessary, they hook you up with therapists or psychiatrists, and medications to help deal with some of these emotions are very common and are very helpful, and not to be ashamed of taking any of those kind of medications. There's a whole host of emotions patients feel when they receive a diagnosis of advanced cancer. Take it one day at a time, and if you're unable to sort of hear what we have to say today, come back tomorrow, or come back next week, or try to put one foot in front of the other tomorrow.